Scientists have sounded an alarm over the new super mutant COVID strain. It is being called the worst ever mutation yet. And this is said to have been detected in South Africa. It's already made its way to Botswana and to Hong Kong. And now there's a case that's being reported from Israel. It is being reported that this super mutant could make vaccines 40% less effective. Several European countries that are already battling a fourth wave have banned flights from 6 African nations. India too has flagged up concerns over the new variant. But will this new mutant actually make things worse in the days, weeks and months ahead?
It's not over yet. A new variant of COVID-19 is here. A worried South African government announced this on 25th November.
From yesterday, indication came from our scientist colleagues from the network for genomic surveillance, that indeed they were observing what looked like a new variant, a mutation, a variant of serious concern, which is now driving this spike in numbers.
The B11529 is the latest in the family of variants causing a spike in cases in South Africa. So what is the new variant all about? The new variant detected has high number of mutations, 32. Director of the UCL Genetics Institute in London, Francois Barlow, reportedly hinted in a press release that the new variant could have evolved during chronic infection in an immunocompromised person, possibly an untreated HIV/AIDS patient. It can be detected with one particular type of RT-PCR test.
B11529. So this is a variant that has been detected and reported to us from our colleagues in South Africa. There are fewer than 100 full genome sequences that are available. We don't know very much about this yet. What we do know is that this variant has a large number of mutations. And the concern is that when you have so many mutations, it can have an impact on how the virus behaves. So right now, researchers are getting together to understand where these mutations are in the spike protein and the furin cleavage site, and what that potentially may mean for our diagnostics, our therapeutics, and our vaccines.
The variant has spread from South Africa to Botswana all the way till Hong Kong. International governments have sounded alarm bells. The UK, Japan and Netherlands have halted flights from South Africa, Botswana, Eswatini, Lesotho, Namibia and Zimbabwe. Singapore, Italy and Israel have placed all of these nations, plus Mozambique, on their red list. The head of the European Commission, Ursula von der Leyen, is proposing the whole of EU put on emergency brakes and stop flights from the region. Germany, which is currently going through a fourth wave of infections because of the Delta variant, will allow only Germans to fly into Germany from South Africa. Even if travellers are fully vaccinated, they will have to spend 14 days in quarantine. India has also sounded an alert. The Union Health Ministry has dashed off a letter asking all states and union territories to subject all international travellers entering India from at-risk countries to rigorous screening and testing. The WHO has designated 4 variants of concern of COVID-19. Alpha or the UK variant, Beta or the South African variant, Gamma or the Brazil variant, and Delta or the Indian variant. An emergency meeting called by the World Health Organization will decide the fate of this super variant, or if countries must do more to restrict the spread of this new mutation.
At the moment, the Indian government has not resorted to imposing an international travel ban on countries like South Africa and Botswana. But sources in the government have informed that India is already operating within air bubbles with various countries. The message is now clear that international traveling and passengers will be screened rigorously and their samples will be collected for genome sequencing at entry points, because a new variant is out to create havoc. With Pavan Kumar in New Delhi, Milan Sharma for India Today.
So is there reason to be worried at this stage, especially amidst reports that the new variant B11529 may be more resistant to existing vaccines? Joining me on the show, Dr Gagandeep Kang, virologist and professor of microbiology at the Christian Medical College, Vellore, one of India's best-known virologists. Dr. Kang, what do you make of this information of the new mutant, ma'am?
This is a very worrying variant. We've been tracking variants for a while, and a lot of new variants keep emerging. But to have a variant that has so many mutations all together, and so many of them in the spike region, is certainly a concern. At the moment, we have information only on a limited number of sequences that have been detected from people in South Africa and then people who have traveled outside Africa to the Middle East and to Hong Kong. And the reason for worrying about this variant is basically, is this going to be more transmissible? Is this going to be able to escape the immune response? If it escapes the immune response, then that means that a lot of spike-based vaccines that we have might not be effective. And if it is very transmissible, we might be in a situation where we have a virus that spreads much more easily than the Delta variant. Now, these are theoretical concerns based on the sequence of the virus. We don't have clinical information as yet.
Yes.
We do have data from South Africa saying that it's growing very rapidly in the Gauteng province.
Dr. Kang, Singapore and Israel have suspended flights from South Africa. India, of course, has called for closer scrutiny of passengers flying in, both from South Africa and now from Hong Kong. Should we, in your appreciation, stop flights? Are we taking a chance just by saying that there'll be closer scrutiny of passengers who come in?
I think the most important thing to do is to track people who are traveling. We need to know, one, whether the people who reach the country are infected. And if they are and infected with this variant, then you would like to ensure that they have isolation for a 2-week period or until they clear the virus. Viruses and variants are going to continue to arise. At the moment, we don't know exactly how dangerous this variant is. So we need to be very proactive in being able to track people, in being able to sequence as much as possible, and in monitoring what is happening clinically to people who might be infected with this variant. Whether we should shut down travel around the world the minute a new variant arises, I think that's not something that is sustainable forever. And this is a good time for us to ramp up our tracking and tracing and sequencing.
Interesting you say that, Dr. Kang. In Hong Kong, the patient, according to doctors' reports that are filtering out, the doctors said the patient had insanely high viral load. In Botswana, reports say fully vaccinated people are also getting infected. What would this mean for fully vaccinated people here, especially, ma'am, senior citizens in India? Could they once again be more vulnerable?
I think there are a couple of things that we need to consider here. One of them is that a very high viral load in conjunction with symptoms is what we need to be looking at. The most important thing is, are we seeing symptoms in the unvaccinated? Are we seeing symptoms in the vaccinated? And how bad are they? That will give us greater information. The other thing to remember is that in India, we have 2 vaccines, Covishield and Covaxin, that are widely used. Since this virus has mainly mutations that are in the spike protein, it will be very interesting to see how this variant performs in people who have received either the Covishield or the Covaxin. Because if it is able to evade the spike responses, right, the antibodies against the spike protein, A vaccine like the inactivated vaccine may have induced antibodies that could still restrict the replication of the virus. So in essence, we still have a lot to learn. The only way we can do it is by doing deep dives into every person who is infected with this virus.
Dr. Kang, is there an apprehension of a sudden spike? There was one that was feared immediately after Diwali. Fortunately, we didn't see that. But when you look at what's happening in Europe, Britain, Italy, Germany, they've either banned flights from impacted countries or they're in the process of doing so. Are we in the clear now about that spike that we were apprehensive about after the festive season?
So I think a spike with the variants that we have circulating is unlikely. What we could see is an increase in infections and in illness in people who were previously exposed to or vaccinated against the virus if immunity wanes. And waning of immunity has been described particularly in the elderly and other parts of the world among vaccinated populations. In India, we have a combination of protection from infection and from vaccination. And one thing we must do is to see whether immunity is waning in the elderly. They will be kind of like canaries in coal mines to tell us what is happening to the rest of the population that may see waning of immunity at a later time point. If there is waning immunity, yes, then you will see an increase in cases, but I think it's unlikely if we don't have a new variant coming in and establishing itself that we will see a spike anything like the second wave that we had. Now, if this new variant from South Africa does turn out to be a hugely infectious variant that is capable of escaping the immune response, then of course we may see another spike.
I mean, God forbid, but which brings me to my next question, ma'am. In India, is it then time for a booster shot? Do we have information or knowledge about the efficacy of the two shots and how long do they remain efficient in our systems?
Well, the rest of the world has data showing that if you have the mRNA vaccine or the AstraZeneca vaccine, somewhere around 5 to 6 months after you received your 2 primary doses of vaccine, you begin to see some waning. But it's important to remember that the rest of the world saw the Delta variant after they had vaccinated the bulk of their populations. And when I mean rest of the world, I just mean high-income countries from which we have data. Now, in India, we had a very different situation where we had infection first, followed by vaccination. And we know that the combination of infection and vaccination gives us better protection than just vaccination alone. So this is why I think it's critically important that we actually start to do deeper dives into our own data to look at deaths by age, which some people have started to do, at least with available data from some states. But more importantly, to look at hospitalization stratified by age, because that will tell us whether we are seeing waning immunity in our population and help us make decisions about when booster doses are needed.
And what is a bigger priority, or what should be a bigger priority for India? Second dose for those who've taken one, but maybe hesitating or thinking it's not required to take the second dose, or a booster shot for healthcare and frontline workers? Should this new variant 1.1.529 be a cause for bigger concern, ma'am?
So I think it's too early to make a decision that is based just on B1.1.529. But I think getting second doses, particularly to the elderly and the people with comorbidities, has to be priority number one. There is no way around it. Those are the most vulnerable people. And we must ensure that we have the highest possible levels of coverage in that group before we begin to think about booster doses for any group other than people who are immunocompromised. People who are immunocompromised may not even make an immune response with the third dose, but we certainly should be thinking about protecting them. I will point out that B11529 comes from South Africa, which also had the beta variant, which is the variant with the greatest immune escape so far. And we know that in South Africa, we have a population that is immunocompromised quite severely because of HIV. And there are the possibilities that when you have viral replication occurring in people who are immunocompromised, that's what gives rise to the variants. So protecting immunocompromised populations as well as we can with the best vaccines we can give to them, that is an absolute priority for prevention of the emergence of new variants.
But, given the fact that people in India are once again, they're slacking, they may not be going for vaccination, whatever be the reason, especially the second dose. In your appreciation, ma'am, is that a serious cause for concern that could compromise everyone? And the approach that the government is adopting, this Har Ghar Dastak, is that the best way forward?
The second dose being not given to an immunocompetent person puts that person at risk. It usually does not create a situation where you will have prolonged replication of the virus. So the purpose of giving the second dose is to protect individuals and then secondarily, hopefully to reduce transmission a little bit by protecting the population. But this Har Ghar Dastak, I think, is an excellent initiative because we really need to reach populations that have either not been vaccinated or people who for one reason or the other have not come for their second dose. We know that 2 doses are important, and in fact there is some doubt now about whether our primary series should actually be 3 doses.
Yes.
We were in a hurry to get vaccines developed, so we have not completely explored the potential of vaccines for prevention of disease, both in terms of breadth and duration. And we really need to be doing those studies, but Har Ghar Dastak, absolutely. It's a program that should be amplified as much as possible.
And now that winters are here, people will anyways face, and some do, these breathing issues. Given that is happening, given that there's a new mutant or a variation, what do you see happen in the weeks ahead? What precautions must people take to, remain out of harm's way, ma'am?
I think we must remember that masks protect us from practically every respiratory infection there is. So for both influenza and SARS-CoV-2, as well as other respiratory agents, wearing masks is going to give us a layer of protection that acts against all respiratory agents. The other things to remember is that viruses spread between people. So to put yourself in situations where there is a lot of crowding, that is best avoided if you want to avoid respiratory infections. And then, of course, vaccination against influenza, against SARS-CoV-2 will prevent a significant proportion of disease.
Dr. Kang, as always, many thanks for joining me here on India Today, because this is a story that remains extremely, extremely alarming at this stage.
Thank you.